In the U.S., nearly 1 in 2 women over the age of 50 will have a fragility fracture or low-impact fracture that is often the result of a fall in her remaining lifetime. If you're a woman over 50 years of age who is postmenopausal, such fractures may not be the result of a clumsy act. They may be due to postmenopausal osteoporosis. To help raise awareness, Bone and Joint Action Week is held every year in mid-October. Joining us now to talk about how to identify the warning signs and discuss treatment options for postmenopausal osteoporosis is Dr. Mary Oates, who specializes in the diagnosis and treatment of osteoporosis. Dr. Oates, what is postmenopausal osteoporosis and who is most at risk?
Well, Dr. Goodwin, osteoporosis is characterized by low bone mineral density and decreased bone strength, which leads to fragility fractures. So healthy bone can generally withstand the forces associated with falling, say falling to the ground after a trip or falling on your hip after a trip. Unhealthy bone or osteoporosis in the bone can lead to fragility fractures. And it's so common that we see it in about 1 out of 2 women who suffer a fracture after the age of 50. And these women are at increased risk because they've lost the protective effect of estrogen on keeping their bone density strong, and they have bone loss after the age of menopause. So in my practice, patients are shocked to find out that a broken wrist is not just an isolated broken bone, but it's actually a signal that they may have underlying thinning of the bones called osteoporosis.
And how common are fragility fractures?
Well, they're very common. It affects 1 out of 2 women after the age of 50, and that's actually why I'm here today. I'm teaming up with Radius Health to provide education and increase awareness about osteoporosis. You know, there's a lot in the media about breast cancer and reducing heart attacks in women that go unrecognized, and I'll tell you that there are more hospitalizations for fractures associated with osteoporosis than there are for a combined number of hospitalizations for breast cancer, stroke, and heart attack combined. So it's common and it's serious and it's under-recognized.
And how do physicians and their patients make the connection between these fractures and postmenopausal osteoporosis?
Well, unfortunately, we're not doing a very good job right now of connecting the two issues, and that's why if a fracture occurs, a broken bone occurs in the wrist, hip, or spine in a postmenopausal woman, that woman should have a bone density scan to evaluate their bone density and an evaluation by their healthcare provider. Now, luckily, we have treatment options available. So we, of course, should be focusing on calcium and vitamin D rich foods. We want to work on exercise to strengthen our muscles and prevent falls, and we do have several medication options available.
And what are they?
Well, they generally fall into two classes. One class is called anti-resorptives, and that decreases the bone, it slows down the bone loss. And the other category is called anabolic, and anabolic agents stimulate the body's own bone-building cells to build more bone. And Tymlos is a medication in that category of anabolics. So anabolics decrease the risk of future fractures at the wrist and other sites. But as with any medication, there may be side effects. There may be an increase in calcium in the urine or the blood, lower blood pressure, or, dizziness. And in laboratory testing, some rats did develop bone cancer, although it is unknown if this will occur in humans. And to decrease that risk, we don't recommend an anabolic medication for more than 2 years total.
I see. Now, what are some of the risk factors for postmenopausal women with osteoporosis?
Well, of course, genetics is a big risk factor. About 80% of our bone health is genetically inherited, but developing good, strong bones from birth to about 20 is very important. So a calcium and vitamin D rich diet is very important. At the time of menopause, it's important to have good balance and strength training. And again, the most important thing is to recognize that a fracture may be the signal that evaluation should occur for osteoporosis. And really to see a healthcare provider to see if Tymlos would be the right medication for you.
Now, as far as the vitamin D and calcium are concerned, when within the age range should women begin to take that?
We now know that calcium and vitamin D are needed throughout the lifespan, and different ages have different requirements, but generally at postmenopause, we recommend about 1,000 milligrams of calcium from all sources. So you take your food sources of calcium and you add in the supplements, your calcium supplements, so that you get a total of about 1,000 milligrams of calcium. And then your vitamin D level, we can now measure a blood test to see if it's adequate, but most people recommend between 400 and 1,000 international units of vitamin D. That's all part of a comprehensive program for good bone health. And if you need more information, you need to talk to your doctor who knows you best, or you can get some basic information at our website, which is bonenews.com, to see if Tymlos is the right medication for you.
Okay, so let's remember that the website is bonenews.com.
Bonenews.com.
Okay, well that makes sense, and your information has been very helpful. I'm sure my Health Power audience will benefit from that information, and also it comes at a great time with Bone and Joint Action Week.
Thank you very much for having me, Dr. Goodwin.
All right, have a good day.
Thank you.